Hi, this is Jacqueline Eckern with Eating Disorder Hope, and today I have the privilege of interviewing Brittany Williams. Brittany is the clinical director of Fairhaven Treatment Center, and she has a Bachelor of Science in Psychology from Mississippi State and a Master of Arts in Clinical Mental Health Counseling from the University of Alabama. She's also a licensed professional counselor and a mental health service provider in Tennessee. And with that, I'd just like to say hello and welcome, Brittany.
Hi, yes, thank you for having me. I'm excited to be here.
Yeah, I'm excited to dive into internal family systems. You've written this brilliant article about this, and I think there's a lot of value for those struggling with eating disorders and their families to consider looking for this treatment modality when they're seeking treatment. So I would like to start off with, how does internal family systems specifically help with eating disorders?
Yeah, so some of the concepts of IFS that can be really beneficial with eating disorders specifically is so as we see the complexity of how the mental illness shows up with eating disorders, that it's not, just one subject or another. It can be multiple, right? Like it can be multiple body image, restricting behavior, some binging behavior, some self-hatred, a combination of things that we see our clients show up in the room with. And what I've seen with IFS is that we can kind of untangle that tangled ball of yarn and identify those things as parts to help our clients take a different approach towards working through that. So IFS sees, if someone has struggles with restriction, IFS can help that person see that it's a part of them that has taken on the role of restriction. And taking that approach helps clients see that it's not all of them that wants to restrict, because 9.9 times out of 10, our clients will say, I want to get better, but I just can't stop doing this. So the concept of parts and working with them as parts is one of the main things that I see really effective with IFS and eating disorders.
That makes sense. And so how do you look at oneself as parts rather than just saying that's the way I am and how I roll?
Yeah. So the model of IFS, it considers us to have multiplicity of the mind, which it's not the only model that's found that to be true with human beings. So that in itself is not entirely new, but the direction it takes is unlike anything I've ever, seen before. And it's so fitting. Like when I learned about this model, I immediately thought about even myself saying, yeah, part of me wants to go and part of me doesn't. Or part of me wants to be here and part of me would rather be somewhere else. Or I'm kind of anxious, but I'm also excited. Like I could just really think about how, wow, in my own life and certainly in clients' lives, I hear so often the multiple things showing up internally, but I hadn't thought of them as parts. So with the clients, of course, we educate our clients and give them the autonomy to decide if it fits for them or not. And through explaining it in just kind of a casual, informal way, I see clients say, wow, that feels like me. That makes sense. And there's so much hope in this, that the reality is, yeah, part of you may engage in this behavior, but it's not all of you. So let's get to know that part of you. And over again, I see that it can be transformed. So it gives people a lot of hope for a real reason that it happens. I don't know if that's fully answering your question.
No, that definitely gives us a better insight into how this works. So are clients ever concerned about, if I see myself as different parts, maybe I'm going to have split up my personality and really endanger my psyche.
Yeah. Yeah. And the founder, I love that any video I've ever seen or any workshop or training I've been in where, people will either quote Richard Schwartz or hear videos himself. That's one of the first things he addresses because yeah, most people's response is, I don't have multiple personality, or now known as DID. I don't have that. Um, but what this is that it's helping clients just see that, as a whole, there's just different parts of us within. But through getting to know your different parts, there's a relationship inside. And as you get to hear from your different parts, you begin to feel more whole. And another important piece of this is to acknowledge this other concept, which is known as the self. And all humans, this model believes all humans have the self. It's a capital S self, which is basically like it's the underneath, right beneath your parts. It's just the core of your being. It's your essence. It's who you are. And the self is what is actually meant to guide the system. But through life experiences, we can all experience that different parts of us end up kind of running the show more so than self. So there's a lot that could be said there. Just let me know, where else I need to go with that.
That's super interesting. So I get that, and it's congruent with a lot of theories of mindfulness and dialectical behavior therapy. And I know it's useful to that sense of self, that centered essence of oneself, to almost consider the soul behind your eyes who's observing. And what it sounds like, and I'd like you to elaborate if you can, when you separate the parts and honor them as all parts of you, but with the wisdom of the self looking over, does that then give you more power to not act on urges or behaviors?
Yes, exactly. So, and I love that you acknowledge some of the other therapeutic models that have a similar concept, because that's it. Like what one model may say, oh, that's emotion regulation. Well, IFS would say, let's help people become more self-led. And it's work that when clients learn how to do it in the sessions, they have a better chance of being able to recognize when they're, quote, in self versus when they are, the IFS term will be blended, when they're blended with one part of them. So the difference could be if you hear the language around someone saying, I can recognize there's a part of me that's really angry right now versus I'm so angry I can't see straight. Like there's a difference in the language when you're accessing self. And self has the power for healing.
So
I should throw that in there. Self is what heals the internal system.
Self is what heals the internal system, and the ability to maybe be to walk the middle line between the different parts of oneself reacting in a situation or to an event would seem like it would lessen the power of one of those individual self aspects of taking over. Just because I'm mad, I don't need to scream and yell in this family discussion. I can say, hey, that's just one part of me. There's another part of me here that recognizes, hey, I value this relationship and I want to tank it.
It's that, being able to recognize when we help our clients learn what it feels like to be in self, and of course there's specific interventions to help do that, it's then they're better able to recognize, oh, my restricting part is really loud right now. And oh, wonder what it's trying to do for me. Because that's the other really important, one of the foundational concepts of IFS is that our parts want what is best for us. Their methods may end up being maladaptive, but their intention is good. And I know we'll talk about that soon, but I have seen that. I've seen it play out, and it's incredible.
Leads us to the next question I have for you, which is, can you tell us some examples in treating folks with disordered eating of all types where internal family systems has been life-changing for them?
Yeah. So, gosh, I can think of a lot of different clients, some active in programming and some who've already discharged, graduated, whatever you want to call it. Yeah, but the process of, I can think about a specific client, them coming in, them talking in parts language, not knowing what IFS is. They just are polarized, as a lot of our clients are, and using the opportunity to tell them about the model, and seeing if they were interested in it, and they were. So walking this client through how to, what we would call, map her system, which is explore, I say terms like explore, which parts of you take up the living room, which, what I mean by that, are most predominantly in your showing up in your life. And so, she's there with some binging and some restricting, and she was able to identify, okay, I have this part that comes in and it'll binge, but then I have another part that then not long after that I'll go on a restricting streak. And so then what we do gradually is what you would call finding these parts one by one and focusing on them, and encouraging the client from a self-led place to get to know these behaviors. So the binging, something that, you may say, oh, they have so much shame around it. But we would say, okay, notice how you feel towards the part of you that binges. And if it's answers that are not from a self-led place, it's another part. And so the client was able to see how many parts show up around her eating disorder, and then gradually get to befriend the parts of her that were eating disordered. And then they got to tell her what they were trying to do for her and what they were afraid would happen if she was not engaging in these behaviors. And through that work, and it's a whole unburdening process of the fear underneath, but through that work, what you see on the outside is, oh, this client isn't engaging in these behaviors as often. And if she does, there's a very quick turnaround, and slowly but surely, these parts begin to trust that herself could handle what those parts were afraid she couldn't. So, so that's an example of like how other, you may say, oh, the client's frequency and severity of behaviors have decreased. Okay, I could use the same language. It's just the approach to helping a client get there is different.
Makes sense. Would you consider this somewhat of a breakthrough therapy, even with folks that are really entrenched in their eating disorder?
I mean, being someone who gets, the privilege of getting to be in a residential facility and PHP and IOP, I would say, yeah, because we see clients who, of course, come into residential very, very sick. And a way that we get to approach this is they're blended. They're considered extremely blended with those maladaptive behaviors. And so while absolutely we're focusing on their nutrition and the stabilization medically, nutritionally, and all of that, absolutely. But clinically, we're able to say, let's really explore, let's help you unblend. And those are all just therapeutic techniques you can use. And we see clients get space from those things and change their relationship with these parts.
Yeah. And can the family itself be involved? I know there's family in the name of internal family systems.
So, and of course, there's lots where Dr. Schwartz himself explains how he got the title of it, but it's really because it's like an internal family. Like our parts have relationships with each other. So we have some parts, all humans have parts that are proactive and parts that are reactive, and they interact, right? Like you may have a reactive part that lashed out at someone, and then you've got a proactive part that's like, oh my gosh, we got to people please, we're going to do whatever we can, that was inappropriate, don't do that. But then that's a very small, I could go on forever about explaining the model, it's fascinating. But the idea is that it's a family inside, and self is the leader of the family. So as you do the internal work, you feel more unitary, and you do see changes in your external world as well. So all of that to say, you're doing the internal family work, and yes, we can incorporate family work into our treatment at Fairhaven, and clients are allowed to explain and speak for their parts and do that work and involve their support systems as needed. Yeah.
It is really fascinating. So can you tell us about your role and what your day looks like at Fairhaven?
Yeah, so I've been a clinician with Fairhaven for well over 3 years, almost 4 years. But recently this year, and I was the outpatient program director for a couple of years, and then I've moved over to the clinical director, which means I'm the director of both programs now, the residential and the PHP IOP. So we provide trauma-informed eating disorder treatment, which we utilize IFS, we utilize EMDR, we utilize a combination of appropriate clinical care for treating trauma and eating disorders. So I'll, of course, have sessions and do those things as a clinician role, and then meet with all of the clinical team. We do lots of consultation and gathering to really conceptualize how we're treating each of our clients individually. And, if the client really is ascribing to the parts work, or if they're more interested in something else, just a very strong individualized approach to meeting our clients where they're at.
That sounds very good. So how does one best get in touch with Fairhaven, and what is that like to explore possibly getting treatment on some level?
Yeah. So of course we have our website, and there's online inquiries that you can fill out. And of course we have our main number, which we do have after hours calls available. So admissions is usually, if you put a call in, an inquiry, you are responded to, if not the same day, the very next day. So we have our fairhaventreatmentcenter.com website, and then I can provide our phone number as well, which is so it's 844-797-7575. I'm like, let me make sure I'm saying that right, because I'm saying it out loud. But yeah, we of course we have social media, website, our sites, and our website. But yeah, we're available.
I will also put that information up along with the article, and on YouTube, the website and the phone number to contact you. And I just have to say, I'm really impressed with Fairhaven. I think I've interviewed 3 different team members, and each interview has just been the knowledge level that your team has, and then the compassion and authenticity that if I were going into treatment, I'd feel like I could bond with this person and find some healing there. I really sense that with Fairhaven. So I'm really honored to share your program today on eating disorder hope and your insights about internal family systems.
Thank you so much. Yes, I really value our team, and like you said, the authenticity. I think this team we have genuinely cares about each and every person. They're not just a number. We know as much as we can about every single client. Yeah, put a lot of work into taking care of them.
Personalized care, which
Yeah.
means a lot. That's wonderful. Well, thank you for your time today. And I hope many people will watch this and check out Internal Family Systems and Fairhaven.
Thank you. I appreciate the opportunity.